Hello friends, today we are going to discuss about the A, B, C and D of dry eye disease and management. Now coming to the A, as we all know that dry eye is very common in postmenopausal women, and also this dry is common after any cataract surgery or LASIK because of the destruction of the ocular surface. Now coming to the B, B stands for any of the BP medications, particularly the beta blockers like atenolol. They are known to produce dry eye by reducing tear secretion. The other beta blocker we often use in topical eye drops is in the form of timolol, which is prescribed for glaucoma patients. So any beta blockers leads to dry eye. Now coming to the C, with C we have to remember that chronic contact lens users are also predisposed to dry eye. Now coming to the other C is the dry eye seen as a comorbidity in autoimmune diseases like thyroid and rheumatoid arthritis, which often presents as Sjogren syndrome. That is, the patient presents with dry eye and dry mouth symptoms for 3 months. Now coming to the D of dry eye, the D stands for diabetes. Long-standing diabetics also suffer from chronic dry eye because of neuropathy. Now coming to the management, we have to understand that as dry eye is also a lifestyle disease, we have to first keep in mind the BMI. The ideal BMI of the individual should be 18.5 to 25. Any BMI which is more than or less than this predisposes to dry eye. In any individual which presents with dry eye, if he or she is more than 40 years of age, we must do a comprehensive diabetic workup by doing glycosylated hemoglobin, because in addition to diabetics, the pre-diabetics are also predisposed to dry eye. So this should be kept in mind. Now coming to the vitamin D level, for any chronic disease to worsen, the level of vitamin D is of paramount importance and it has to be more than 30 nanogram per deciliter. And this vitamin D works best in combination with the other fat soluble vitamin, that is the vitamin E. And this vitamin E works best in combination with omega-3 fatty acids. So the American Heart Association strongly recommends bi-weekly consumption of fatty acids. Now coming to the workup, whenever the patient presents with some severe dry eye or Sjogren syndrome, we must investigate the patient on the line of autoimmune diseases. For that we have to do a thyroid profile, rheumatoid arthritis and anti-nuclear antibodies. Now coming to the medical management, the dry eye in mild to moderate cases is often managed best with lubricants, and the best of the lot is sodium hyaluronate eye drops. In moderate to severe dry eye, we have to supplement this hyaluronate with cyclosporine eye drops to increase the tear secretion. And in severe dry eyes like rheumatoid arthritis or other autoimmune diseases, we have to resort to autologous serum, which is prepared from the patient's own blood. So to sum up, we have to remember that dry eye is a syndrome, not a disease, and all these facts should be kept in mind during its management. Thank you.